colon cancer has very high cure rates if done by a good surgical oncologist. Hi, I am Dr. Sunil Jaiswal, consultant surgical oncologist, Apollo Cancer Hospital, Bhubaneswar. If you look at the common symptoms that a patient has who has a colon cancer, the most common symptom is altered bowel habit. What that basically means is the patient or the individual is having an altered constipation and diarrhea. Some of the days he's constipated and some of the days he's having diarrhea. If you have this symptom, you need to be evaluated closely by a gastroenterologist or by a surgical oncologist. The next common symptom that a colon cancer patient has is per-rectal bleeding. You will have bleeding per rectum, bleeding through the anum. The blood may be either frank or it may be mixed with blood. The other symptoms may include weight loss, vague pain around the abdomen which is crampy in nature, persistent in nature, and one specific symptoms that comes with this cancer is usually which happens in males is weakness, fatigue due to anemia. If you are above the age of 50 and if you have anemia which it's not diagnosed, you should exclude that you do not have a colon cancer, because in males having anemia is very rare. Women have anemia due to their menstrual periods, but males usually do not have anemia, and if they have anemia they need to be worked up to exclude colon cancer. Now coming to workup, the most common workup that we do in colon cancer is a colonoscopy, wherein we put in an endoscope through the large intestine and we directly assess the whole colon, and if we find anything suspicious we usually take a biopsy. The usual report time is around 2 to 3 days. After the report we usually do a workup to assess the extent of disease, whether the disease is localized or it has spread. After the workup we plan him for surgery, and if you look at colon cancer, the definitive treatment is surgery, which gives you high cure rates. Surgery can be in forms of two methods, either an open method or a minimally invasive method. Minimally invasive methods has two aspects, either it can be done laparoscopically or robotically. Robot is the new era of surgical oncology, gives dramatic results and the stay is also decreased. Now coming to the cure rates that you see with colon cancers, it's quite remarkable. Even in advanced cases you have a cure rates approaching 70 to 80% of the times, and most of the patients usually are cured with surgery. If there are any adverse features or if the stage is a tad higher, then he may require chemotherapy post-operatively. That's the duration for a duration of 6 months, and with regular follow-up most of the patients do well and most of the patients lead a normal life after this surgery.